Well, as we know, there's a lot of rare side effects that can occur with chemotherapy that we like to make our patients aware of. Patty, one of the changes we see, especially with very specific chemotherapy drugs, are nail changes.
Mm-hmm.
Could you discuss those a little bit?
Absolutely. It sounds like a minor thing, but it's something that can be very problematic for the patients who actually experience problems with their nails. Most important thing is to make sure that you're not getting manicures or pedicures, that you're actually observing your nails, making sure that there's no redness or tenderness in the nail bed itself. We will let you know those drugs which are specific or would cause specific problems for your nails. But in general, everyone who is getting chemotherapy needs to be aware that they need to take good care of their fingernails and their toenails. Obviously, you want to keep your nails trimmed. And you also want to keep your toenails trimmed, but you don't want to get down into the cuticle or cause any kind of interruption in the integrity of the skin. Keeping your skin intact will be important because it's the first barrier against infection. If you notice that you have an area on your toes or your fingers that looks inflamed or looks like it's tender or has some infection, you would want to let someone know, because we would want to take care of that perhaps with an antibiotic, or at least address that in some fashion.
Absolutely, and we certainly discourage or do not want patients to use false fingernails.
Absolutely.
Or glued-on fingernails.
They can use fingernail polish, but generally that would be true. We would want, if they have false fingernails on when you come to the office prior to starting chemotherapy, generally sometimes taking off those nails can cause more damage than just allowing the fingernail to grow out and not to replace them and just clipping them off. Sometimes if you take those nails off, it can really make the nail even more tender. So, but not to obviously continue that process would be important.
Great. And Rachel, we know that certain chemotherapies or certain treatments can affect the bladder or urine. Can you talk a little bit more about that?
Yeah, some of the drugs are more tough on your bladder area, so we really want you to push lots of fluids. That's one of the major things we tell you, is make sure you still have that whole hydration factor. The better hydrated you are, the better you're going to be flushing things through, and the better you're going to keep your kidneys working.
Okay. Which some of the medications can also affect urine color. Is that true?
Adriamycin is a big one. Usually after you get that drug, your urine will be red, which is pretty common. We expect it to happen. It shouldn't be like a bright red, like actual blood. If that's the case, then we definitely want to know about it.
And we often get questions from patients about staying out of the sun while you're on chemotherapy. What are your thoughts on that?
Well, we recommend to the patients that you can be outside and you can be in the sun, but we like for you to wear sunscreen, be protected with hats and long sleeves, and maybe not spend a full day in the sun. Even with protection, you're still going to get some exposure. You can definitely burn a little easier while being on the chemotherapies, and then sometimes actually have rashes from the sun or some sun poisoning.
And I think one thing we always try to emphasize to patients is, there are 75, 100, maybe more drugs that we call chemotherapy, and there are side effects which are quite common and can be anticipated and discussed, and there's going to be side effects that are quite uncommon or unusual. And so one thing we always stress to patients, I think, is that if you ever have a question and you don't know whether you should call, please go ahead and contact us. And there's always a physician in the office, so while you're getting an infusion, if there's an allergic reaction, they'll be immediately available. And then off hours, there's a 24/7, 365 physician available on call for any concerns or questions that exist. It's impossible, of course, in a video of this scope to address every potential problem that can occur, but certainly if patients are noticing anything that's concerning or unusual, they should contact us immediately and we can address it for them. We've probably heard the problem multiple times before, even though it seems unusual to them. So that's certainly a point I think all of us want to leave with the patients going forward. This video is meant to be a guide to them, but cannot be all-inclusive, and we're available at any time for questions that may arise during their treatment.